What you do after dinner may be determining the success or failure of your glycemic control, and ignoring this now can cost you months or even years of progress in diabetes.
If you have diabetes and believe the danger ends when the plate is taken off the table, you may be making one of the most costly mistakes for your health right now. There is a common after-dinner habit that triggers a silent glucose spike while you sleep, even when dinner seems appropriate. The problem is that this night habit is so normal that almost no one questions it. And thousands of people only realize it when lab tests show blood sugar levels higher than expected. With each night this mistake is repeated, the body becomes less efficient at blood sugar control, and the risk of insulin resistance increases, creating an invisible cycle of imbalance. The most dangerous part is that this effect does not appear immediately. It builds up day after day, causing all the effort you make with food during the day to be undone in just a few hours of sleep. The most common after-dinner mistake that raises blood sugar in people with diabetes is snacking while thinking it's just a little and that it won't make a difference. Small pieces of bread, cookies, chocolate, unsuitable fruits, light desserts, or even sweetened coffee seem harmless. But at night, the body has lower insulin sensitivity and a slower metabolism, which turns this habit into a programmed glucose spike. This night habit is dangerous because it does not cause an immediate sense of a problem, but it silently alters blood sugar levels while you sleep. Another serious mistake is going straight to bed right after dinner, without giving the body time to properly metabolize the glucose consumed, which worsens blood sugar control and promotes insulin resistance over time. For people with diabetes, this pattern creates an invisible cycle. Each poorly controlled night increases the chance of morning glucose spikes, makes it harder to control glucose during the day, and increases dependence on medication. The brain learns this behavior as routine, and the body starts to expect sugar at night, sabotaging any attempt to stabilize glucose levels. Ignoring this common after-dinner mistake is allowing diabetes to set the rules while you sleep, accumulating metabolic damage night after night without you realizing it. If you made it this far, it's because this content is exactly what you needed to hear. And now there is a decision that only you can make. Either you keep getting scattered information and let diabetes control your routine, or you subscribe now to the Health Insight MD channel and start learning, in a practical and direct way, how to keep your blood sugar under control in everyday life. This channel exists for people who no longer want to live hostage to glucose spikes, bad test results, and fear of what might happen in the future. Every video here is designed to help you understand what truly affects blood sugar levels, avoid common mistakes, and build habits that reduce insulin resistance. If you don't subscribe now, you will miss content that can prevent real problems in your health. So hit the subscribe button, turn on the bell, and join the people who decided to stop making mistakes without knowing it and start controlling their own glucose with awareness and strategy. The common mistake after dinner begins with the false feeling that the day is already over and that a small slip won't make a difference. For people with diabetes, this way of thinking is one of the biggest saboteurs of blood sugar control. Snacking after dinner, eating a piece of chocolate, a cookie, an unsuitable fruit, some bread, or even drinking sweetened coffee creates the perfect scenario for a nighttime glucose spike. The body is already entering rest mode, the metabolism is slower, and the insulin response is lower, which makes any extra carbohydrate have a much greater impact on blood sugar levels. In addition, going straight to bed right after eating is another dangerous night habit. Because glucose stays circulating in the blood without being efficiently used by the muscles, increasing the risk of insulin resistance over time. The problem is not just the visible sugar, but the combination of the wrong time, the wrong amount, and the wrong type of food after dinner. This repeated pattern turns nights into silent moments of loss of control, where diabetes advances without immediate symptoms but with accumulated consequences. Many people believe that dinner is the villain, when in fact, the biggest mistake is in after-dinner behavior, which causes glucose spikes while the person sleeps and wakes up with high blood sugar without understanding why. Every night this habit is repeated, the body learns to handle glucose worse, making control harder the next day and increasing dependence on medication. Ignoring this mistake is allowing a simple nighttime habit to destroy all the effort made during the day to keep diabetes under control. The consequences of this nighttime habit for people with diabetes go far beyond a simple high number on the blood glucose meter. When a person maintains the habit of snacking after dinner or going to bed soon after eating, the body begins to experience repeated glucose spikes during the early morning hours. This directly leads to morning glucose highs, causing the day to begin with elevated blood sugar levels and a feeling that nothing is working. This pattern generates a dangerous cycle. The more nights with glucose spikes, the greater the insulin resistance, and the greater the insulin resistance, the more difficult it becomes to control blood sugar throughout the day. The person believes they are doing everything right with their diet, taking their medication correctly, but continues to see high numbers, which creates frustration, discouragement, and a feeling of personal failure. The problem is not a lack of effort, but a strategic error that happens silently during the night. Over time, this repeated lack of control increases the risk of diabetes complications, such as circulatory problems, chronic inflammation, constant fatigue, and greater difficulty losing weight. As the body begins to store more glucose as fat, every night that blood sugar remains high is as if the body is trained to accept poor glucose levels as normal, making control increasingly difficult. This habit also impairs sleep quality, which further worsens insulin sensitivity the following day, creating a domino effect. Poor control at night leads to poor control in the morning, which leads to an entire day of unstable glucose. If this pattern is not corrected now, it becomes an automatic behavior, and diabetes begins to dictate the rules without the person realizing it. The price is paid silently, every day, with greater dependence on medication, more difficulty controlling diet, and a higher risk of living with consistently high blood sugar. Correcting this habit is not just a change of routine. It's a decision that can interrupt a dangerous path before it becomes irreversible. What to do instead of this mistake starts with a simple but powerful decision. Interrupt the automatic pattern that happens after dinner. Instead of mindlessly snacking or consuming foods that cause glucose spikes, the priority should be to create a real interval between the last meal and bedtime. This time allows the body to better process carbohydrates, reduce blood glucose levels, and stabilize blood sugar levels before sleep. For those with diabetes, this pause is strategic because insulin sensitivity decreases at night, and any excess becomes a much larger blood sugar spike than during the day. Avoiding sweets, bread, cookies, chocolate, and sweetened beverages after dinner is one of the most effective ways to protect blood sugar control without needing to increase medication. If hunger strikes, the choice makes all the difference. Instead of foods high in sugar or fast carbohydrates, the best option is combinations that don't cause glucose spikes, such as small portions of protein and fiber. These foods help keep blood sugar more stable and reduce the chance of insulin resistance over time. Small changes to this nighttime habit create a positive, cumulative effect. Fewer spikes during the early morning hours, less morning glucose, and greater ease in maintaining control throughout the day. This isn't about starving yourself. It's about teaching your body to end the day without excess glucose circulating in the blood. Another essential strategy for those who want to improve their diabetes blood sugar control is to monitor glucose after dinner. Measuring blood sugar levels at this time reveals exactly how your body reacts to what you eat and what you do after the meal. This habit makes control concrete because you begin to see the real impact of your behavior after dinner. By identifying glucose spike patterns, it becomes easier to correct choices and avoid repeated mistakes. This restores autonomy, reduces the feeling of being at the mercy of the disease, and strengthens conscious decision-making. You don't need to eliminate dinner or live in fear of food. The real adjustment lies in what happens after it. By replacing nightly snacking with a routine that promotes glucose stabilization, the body responds with less insulin resistance, fewer abrupt blood sugar fluctuations, and more predictability in diabetes management. This is the kind of change that seems small, but it separates those who live with constantly high blood sugar from those who begin to regain control. Correcting this habit now means interrupting a silent cycle of glucose spikes that happens every night, without most people realizing it. The point isn't dinner itself. It's what comes after, and if that resonated with you, it's because this conversation is also relevant to your routine. If this content helped you better understand how small choices after dinner influence blood sugar, stick around, because this channel is exactly for that. To bring clear information to those who want to improve their diabetes control without complicating their lives. If you've made it to the end, leave a comment saying, "This message was for me," just so I know we've been together this far. If you feel this video provided value, a like is a simple way to show that and helps me continue bringing content that truly makes a difference in blood sugar control. And there's a video here that complements this topic and can help you even more to avoid glucose spikes at night. Click on it now and continue with me there.